I had a question about your time in Berry. I'm headed up to the Riverland for a whole year next year for placements in third year. I'm very excited about it. What was it about rural work that got you so inspired?
At that time, it was, so when I was in Berry, there were two surgeons there, one called John Nettlefold. He was a great old-fashioned country general surgeon. And there was another fellow who was a bit younger called Arnold whose son became an anaesthetist. I think the thing that inspired me by those guys is that they just could do anything and everything and do it reasonably well. So we would have a list, we'd have a couple of carpal tunnels, then we'd do a lap collie, and then we'd do a big bowel resection, and then we'd do, I remember taking out a kidney up there once, Denby, believe it or not, for trauma. That was interesting. You know, there were all these really cool things that we did, and I really liked the breadth of the experience up there, and I was pretty keen at that time to continue doing rural work, and it's, you know, I can continue to do that just because it is very broad. You know, if you become a general surgeon in the Royal Adelaide here, you, by its very nature, you end up becoming quite subspecialised. You know, you become a colorectal surgeon, and then even within colorectal, for example, that has become super specialised for some of the surgeons there who would just do rectal cancer, for example. So that was the thing that inspired me.